What is rugby? Well, today you'll learn a little bit more about what muscles are used to tackle in rugby.
So, when starting the run, there are three phases mainly: the push off phase, the swing phase, and the landing phase. Going into the pushing phase, the ankle joint extends as you push off the ground, propelling you forward. We use the ankle joint as we push off the ground to propel ourselves forward. The knee joint also comes into play as it extends to provide power and momentum. The hip joint is engaged as it extends to support the forward movement. The abdominal muscles help maintain the stability and proper posture during this phase. We use the rectus abdominis and transversus abdominis to stabilize the core and maintain proper posture during the powerful push-off. The obliques play a crucial role in stabilizing your core and transferring force between your upper and lower body and undergo isometric contractions, maintaining stability and providing core support during the push-off. We engage in the calf muscles, gastrocnemius and soleus, to push off the ground. The quadriceps, the rectus femoris, vastus lataris, vastus medialis, and vastus intermedius help extend the knee and shortening while generating force to extend the knee and propel you forward and undergo eccentric contractions, meaning they lengthen while generating force to control the movement. The glutes, the gluteus maximus and gluteus medius, provide power for the push-off, while the calf muscles also contract concentrically to push off the ground. Jumping into phase 2, which would be the swing phase. The hip joints flex as your leg swings forward and the knee joint flexes as your foot lifts off the ground. The hip joint flexes as the legs swing forward, allowing for a smooth and efficient stride. The knee joint flexes as the foot lifts off the ground, preparing for the next step. The ankle joint maintains and remains relatively neutral during this phase. The abdominal muscles provide stability and support during this phase. The internal and external obliques come into play and help with trunk rotation and maintain stability as the legs swing forward, and the rectus abdominis provides stability to your core and help maintain proper posture during the swing phase. They may undergo isometric contractions to provide stability and support during the swing phase. The hip flexors, iliopsoas, rectus femoris, lift the leg forward while undergoing concentric contractions, shortening to bring your thigh forward. The hamstring, aka the biceps femoris, semi-tendinosus, and semibronosus, control the legs backwards, swing while undergoing eccentric contractions, controlling the forward swing of your lower leg. The hip adductors, gluteus medius and gluteus minimus, stabilize the pelvis. The hip flexors contract eccentrically to control the forward swing of the leg, and the knee flexors contract eccentrically to control the lowering of the leg. Now landing into the last phase, which would be the landing phase. The ankle joints flex as your foot makes contact with the ground, providing shock absorption. The knee joint flexes to absorb the impact and help stability, and the hip joint also flexes slightly to accommodate the landing. The abdominal muscles help stabilize the trunk during landing. The rectus abdominis and transversus abdominis work together again to stabilize the core and control the landing. Ensuring proper form and balance, they may go under isometric contractions to provide stability and support during the landing phase. The quadriceps work eccentrically to control knee flexion during landing, such as the rectus femoris, vastus lataris, vastus medialis, and vastus intermedius. Undergo eccentric contractions to control the bending of the knee during landing. The calf muscles, such as the gastrocnemius and soleus, help absorb the impact. The hip stabilizers, the gluteus medius and gluteus minimus, maintain balance and control, while is in the calf muscles also contain eccentrically to control the lowering of the foot, and the knee extensories contract concentrically to extend the leg.
Once you are close enough to your target's range, you then have to drop down in order to target their center of mass and vulnerable aspects, the legs. This also prevents any high tackles and injuries from those tackles. The drop-down movement is very similar to that of a lunge, in which the front leg you have depends on the tackle situation. One leg is anterior to the other, and this anterior leg is flexing at the hip, knee, and ankle, while the posterior leg is extending at the hip, but still flexing at the knee and ankle. Additionally, the upper body will be leaning forward at an acute angle. Although the primary muscles contracting are those in the leg, the abdomen is still doing a good amount of work. The anterior leg uses psoas, iliacus, and sartorius to extend at the hip, and semitendinous, semimembranous, and the bicep femoris, also known as the hamstrings, to flex at the knee. In helping to lift the femur, psoas, iliacus, and sartorius perform contractions, and there are several syngenous muscles that help with this, which include rectus femoris, the quadriceps that are vastus lateralis, medialis, and intermedialis, as well as tenaris, fascias latia, anterior abductors, which include pectus nemus, adductor longus, adductor brevis, adductor externus, as well as adductor magnus, with gracialis as well. These all help to lift and stabilize the femur. The rectus femoris and the quads are performing eccentric contractions to do this, while tensor fascialis latius, as well as anterior adductors, are performing isometric contractions. In helping to lift the flex the fibula and tibia, the hamstrings are performing concentric contractions in order to do this, as well as popliteus, which provides some assistance. In order to stabilize this, the synergist muscles that are used are soleus tibialis anterior, extensor digitorum longus, extensor hallucis, and gastrocnemius, which are isometrically contraction to help stabilize the knee and ankle as well, seeing as the foot is planted on the ground fully. As the lower limbs are getting into position, the trunk will also have to flex in order to get as low as possible and complete the best tackle. This means that the external abdominal oblique, as well as internal abdominal oblique and transverse abdominis, will all have to assist the rectus mundus, the main agonist, as they all concentrically contract to flex and stabilize the trunk as it descends.
The third phase is the punch. Continuing with the motion of the lunge, you then begin to swing your arms backwards with the help of the flexible ball and socket joint glenohumeral. The starting position for this phase is having the arms bent slightly behind you, the shoulders pulled back, and with your chest leaned slightly forward. Having your arms bent behind you causes your bicep to flex and contract concentrically, while the tricep contract isometrically. With the arms bent slightly, the hinge joint humeral ulnar is in use. The deltoid is slightly contracted concentrically due to the slight abduction of the arms away from the body. The brachioradialis and the forearm muscles are all contracted isometrically. The trapezius, latimus dorsi, and the lumbar triangle contract concentrically, allowing the shoulders to be pulled back and having the body in an upright position, holding the head. Then, the supraspinatus, infraspinatus, tres major and minor contract concentrically, allowing the arm to stay in the position with the bend of the elbow and the shoulders pulled back. The pectoralis major and minor are contracted eccentrically, helping move the arm slightly behind you. The serratus anterior is also contracted eccentrically, which helps with the upper body to stand up straight. The external intercostal, internal intercostal, and the subscapularis also help with the lean forward upright position of the body and are contracted eccentrically. For the core of the body, the rectus abdominis, external abdominal oblique, transverse abdominis, internal abdominal oblique, and most of the core muscles are contracting concentrically because of the flexing of the muscles and lean forward position. Then, the next step is the tilt of the head. When the shoulders still pulled back and arms slightly behind the body, you have to tilt your head to the opposite direction where you're going to tackle and away from the opponent's knees. With the help of the anterolateral joint, it helps with tilting and stabilizing the neck while also moving your head. The sternocleidomastoid works synergistically with the splenius capitis and they contract eccentrically and is a very important muscle for tilting your head to the side. The trapezius, levator scapulae, medial scalene, and anterior scalene also contract eccentrically, helping the tilt of the head. But on the opposite side of the neck, these same muscles are contracting concentrically. The last position for this phase is having the bent arms in front of the body. After tilting your head to either side, then continue with the swing of the bent arms forward, completing the punch. With this motion, the biceps are still contracting concentrically to flex the arm, but the triceps are contracting eccentrically due to holding the arms up. The deltoids continue to contract concentrically due to the slight abduction of the arms. The forearms muscles continue to be contracted isometrically. The back muscles continue to contract concentrically to help the arm stay up. Also, the core muscles are still engaged and being contracted concentrically, preparing for the tackle of the other opponent. While the chest muscles like the pectoralis major and minor, the serratus anterior, external intercostal, internal intercostal, subscapularis are all engaged and contract concentrically, helping the arm stay up, which ends phase 3 and transitions into phase 4.
Now that you're in close contact with the target, this is where we'll finish off the tackle with the grab and finish off the running position. The quadriceps are a group of 4 long muscles located on the front of your thigh. While running, they extend your knee and propel you forward. The energy that begins in your quads is transferred into the hamstrings. This is where you'll finish off the running and start your next motion. This motion is similar to a hugging position. Using your deltoid muscles, you'll wrap your arms laterally around the posterior part of the opponent's quadriceps, squeezing in to take them off balance. The supraspinatus will allow you to have full range of motion to effectively grab the opponent. The trapezius muscle allows the muscle to lift the scapula and rotate it. The forearm flexors, forearm extensors, biceps, triceps, wrist flexors, and wrist extensors, intrinsic muscles of the hand will allow you to have a tight grip around the opponent to be able to tackle them. But do not forget, the gluteus maximus and quadriceps will allow you to get to the proper height to tackle the opponent to the floor. Like the hamstrings, the glute complex, gluteus maximus, minimus, and medius plays a key role in propelling your body forward. The gluteus maximus works to extend the hip as you push off the ground, and the gluteus minimus and medius work together to shift your weight from side to side. Now, let's imagine you're running with the ball and the opponents are all trying to tackle you. You dodge, twist, and run, but then out of the corner of your eye, you see this massive player that looks like The Rock. Then, boom, you get tackled straight to the knees and your left knee pops. And you're in blinding pain and you look down and your knee is all swollen. So you lay there and wait for the paramedics, but when they came, the swelling went down and thankfully you can still walk. But you're still in pain and feel unstable. Well, you tore your medial collateral ligament, or known as MCL. This injury is very common with rugby players. This ligament runs from the inside surface of the upper tibia bone to the inner surface of the bottom of the femur and is on the inner side of the tibiofemoral joint. This ligament keeps your tibia in place. There are different grades of an MCL. The first one is in the mild sprain that can be caused by direct trauma to the knee. The knee still remains stable but will likely be painful and tender. The second grade is having the ligament moderately damaged with the partial tear and the knee is loose. This is more painful than the first grade and there's tenderness and swelling of the knee. In this case, you might need surgery to recover from this level. The third and last grade is the most severe MCL injury when your ligament is completely torn. With this level, your knee will be loose and painful. This type of tear can often accompany other damage to your knee, such as an ACL. Because the MCL is on the knee, it affects the tibiofemoral hinge joint and greatly allowing little to no movement, causing it to be very difficult to bend the knee or do routine activities such as climb stairs or sit in a chair. There is stiffness and a lot of pain. Even with the first level tear, it would still be very difficult to walk